everyone, welcome to Rainbow TV. Today we have vascular specialist Dr. Shaileshkumar with us. Breast fibroid. We often hear that and let us get more information about it. Hello sir, hi.
Hello, hi.
How are you?
I'm fine.
So as we discussed breast fibroid, like what are the causes of that?
See, most of the times these breast fibroids, they are benign lump or swelling in the breast.
Okay.
And sometimes these are, because we see them commonly in the young girls like 15 to 25.
Okay.
So a lot of parents and the patient who's suffering becomes very anxious and they are very scared why this lump has developed. And any lump in the body is, most of the times patients are scared because they think it is a cancer. So first thing which I want to tell you is the breast fibroadenomas are non-cancerous thing. They are not cancerous, and 98% they don't convert. 98% they are simple benign lumps. Only less than 2% chances of them getting converted into the cancer is there. So you need not to worry about that. So reason wise, familial, sometimes it can run in family, especially if your parents or aunties are suffering with the breast fibroadenoma. Possibly you may develop the breast fibroadenomas or genetic. Another is the hormonal imbalance.
Okay.
Like because of young girls, when the hormone starts producing at the early age, these breast muscles or tissues, they start responding to this hormone and they become lump-like.
Okay.
So that is the thing. Another is the fast food. Our lifestyle has played a significant role. Okay. So these are the main reasons for the breast lump to form in the early age.
Like, is it common, sir, or
it's a very common problem we see in the young girls. It is one of the common problem we see in my clinic. I see in my clinic with the breast related problems. In all the breast problems, fibroadenoma is the most common one I see. Okay. So it is very common, but need not to worry. Fortunately, it is not a cancerous or worrying thing. But so having said that, we should get it examined. Get a examination by the doctor, if required get an ultrasound to see whether there are no features suggesting of cancer, and if any doubt, we have to get a fine needle test, put a needle inside, get it on the examined under microscope and see that it is fibroadenoma only and there is no features of cancer. Especially if it is familial thing, if the parents or grandmother or auntie, anyone having breast cancer, or the patients, this lump has increased in size suddenly. Previously it was 2 centimeter. Now we are experiencing that it has become 5 centimeter, 6 centimeter, double in size. Or there is sudden pain in, because most of the times these fibroadenomas, they are simple, benign. They doesn't cause any symptoms. They are just touch. They feel, the patients feel just a swelling. It is not even painful to touch. So it's a simple thing which keeps moving under the breast. So we call it as a breast mouse also. It keeps moving. It is not at one place. So that is the thing. But definitely you should get it examined or tested with FNAC. If there is sudden increase in size, if the patient is experiencing any pain within the lump, or the family history of breast cancer is there, because these are the things which are worrisome, that the lump can be cancerous. So we should get it tested with FNAC and if required biopsy as well. So
if those lumps treated early, can we avoid not turning them into cancerous?
See, if it's on the FNAC or biopsy, if a fibroadenoma, you need not to worry, because they are just benign. As I said, there is less than 2% possibility that it will convert in cancer. But we should do the biopsy or testing to identify that it is not cancer. Whatever the lump we are seeing, it is not cancer. So if it's cancer, because it's in the early stage, we have to treat it before it is getting spread to different parts of the body. So that is the main purpose of doing the biopsy or FNAC test.
Okay, so like as you said, it occurs mainly in young girls. Will those girls can detect that there is a lump inside their breast?
Definitely, when they take bath or when you touch the breast, you will feel the difference. Previously, it was not there. Suddenly, I am feeling something hard structure in the breast, or something is moving, which is a lump-like or mass kind of thing in the. So self-examination is very important. If you are having noticing some changes in the breast recently, definitely you go and should get it checked with your doctor. Also, if required, get a scanning done and FNAC or biopsy test done to confirm it, because it will give peace of mind. Otherwise, you will always in worrying whether it is a cancer or a non-cancerous lump. From the treatment point of view, there are no medications which will cure these lumps, because these are the lumps. There is no medicine which is effective in curing that. But having said that, all lumps doesn't require treatment. If it's small lump, if it's already proven it is a not cancerous thing, you can just observe. Sometimes they can remain in that stage only. They may not grow in size. So you just observe them, do a repeat ultrasound scanning to see whether it is increasing in size. If it's small size, is okay. And sometimes because of this hormonal sudden surge in the young age, this can form, and because the hormonal, some ladies they maintain the hormonals, there will not be hormonal imbalance. In those ladies, it can remain at that stage only, it will not develop. So all fibroadenomia doesn't require any treatment or any surgery, and there are no medications for it. But if there is family history of cancer, if the swelling is increasing in size rapidly, or if it is painful, and sometimes some ladies they want it get it removed cosmetically as well. So for them we can do the treatment. In the olden days, we were doing the surgery where we cut the breast, identify the lump, cut the lump, removed, and then put sutures, close the skin. So that was a major surgery, and there are a lot of scars, bleeding and complications associated with that. And even if sometimes if it's small cut and all, sometimes that develops scars on the breast, and most of the ladies they want scarless treatment. So for there is one very exciting option is there, and a lot of girls and even the parents are excited about this treatment, that is VABB treatment, that is vacuum assisted breast biopsy. VABB, vacuum assisted breast biopsy or vacuum assisted breast surgery, where similar how we are doing the testing through the fine needle, we put a fine needle inside, it will cut into that lump into pieces and suck it out through the same hole. So there will not be any cut, there will not be any sutures, there no blood loss. So it has very exciting option, especially for young girls. And it has even those girls who don't want any scar from cosmetic point of view also, there will not be any scar with this. And lot of patients and their parents ask like whether this VABB treatment will remove completely. Definitely, because in surgery we are cutting we are having a major cut on the breast and removing that lump as a whole. Here we are not removing it as a whole, we are cutting that lump into small pieces, like small pieces, and then sucking it out. Because this treatment is done under ultrasound, like how we are identifying this breast lump, we are doing under this treatment also, we are doing under same ultrasound, where we can see whether the lump is completely removed or not. So we at the end of the procedure will come to know, we see whether there is any leftover or residue is there, or whether it is complete. So because it is done under ultrasound, we know that whether we are removing it completely or not. And completely, fibroadenoma can be removed completely with this treatment.
Okay. Yeah, sir. Thank you. Thanks for your time and sharing the information.
Thank you, madam.